there's a common question that kind of underpins everything we do here. And it's if St. Jude doesn't do it, then who's going to? Who's going to step into the gap for the children and the research that ultimately impact that child?
Welcome to Technovation. I'm your host, Peter High. My guest today is Keith Perry. Keith is the Chief Information Officer of St. Jude Children's Research Hospital, an organization whose mission is to advance cures and means of prevention for pediatric catastrophic diseases through research and treatment. Keith and his team are helping advance St. Jude's research agenda with better data science while improving the patient journey along the way. I look forward to hearing more about his nearly decade as Chief Information Officer of St. Jude's through this conversation. Keith, welcome to Technovation. It's great to speak with you.
Thanks, Peter. I appreciate the opportunity to come sit. You've got a great podcast, and it's just a blessing to be here. So,
I feel the same way. All the better with your inclusion in it. So, thank you so much. Well, let's begin, if we could, with St. Jude Children's Research Hospital. Talk a little bit about, especially as somebody who's been immersed in healthcare for quite some time. Talk a bit about St. Jude and what makes it special.
Yeah, there's a good chance that I think 4 out of 5 Americans have heard of St. Jude, right, through our commercials. But what we say is we're more than just that commercial. And so if our story really started back in early 60s and 1962. Danny Thomas, a struggling actor at the time and comedian, he said a prayer, and basically he said, look, if I make it successful, then I'm going to give back. And that giving back resulted in the formation of St. Jude. And his vision was really that no child, and is really focused on pediatrics, but no child's really denied treatment based upon race, religion, or that the family's ability to pay. And so carry that forward to today. And like you kind of commented, our mission is really to advance cures and means of prevention for pediatric catastrophic disease through research and treatment. So it's both the combination of clinical care and then the scientific research discovery that kind of guides St. Jude. So located in Memphis, Tennessee, we've got affiliates throughout the country, and then kind of a global presence, and we can kind of talk about that as well. So.
Well, let's do so now, if you don't mind, Keith. Talk a bit about the organization's reach. I would love to hear more about it. I know you're based in Memphis, as a lot of the organization is, as you noted, but how broad does the organization span now?
Yeah, it spans around the globe through various networks, and then that's not a clinical care mechanism for us. So if you think about it, 80% cure rate in the U.S. and developed countries. When you go to undeveloped countries, that number's flipped, right? So only 20% of the children that are diagnosed with catastrophic disease survive. And so our focus and our mission, when we think about where we're going to be in 2040 and beyond, is how do we elevate and lift those boats as well. And so we've built our St. Jude Global program to not only help with the training and education that's needed, but how do we work with governments? How do we work with the World Health Organization? And how do we just share the information and the knowledge that we have to those countries that really are in desperate need of how do they treat their children? And so that's kind of a general overview of St. Jude from a global perspective.
And talk, if you would, Keith, about your role as CIO. As I mentioned, in August, you'll celebrate 10 years with the company as Chief Information Officer. Would love to hear more about your purview.
Yeah, it's truly a blessing and an honor to serve the St. Jude mission. And so my role as Chief Information Officer is I'm responsible for the technology. So what the technology that really underpins the mission. So whether that be supporting the clinical enterprise and how do we deliver care to the patient that's sitting in front of us, to the research and how do we empower and make sure our researchers and investigators have the best technology at their fingertips to advance their knowledge discovery, that really kind of feeds back into how we treat children.
And how do you think about serving each of those constituents, from patients to caregivers to researchers? All very important, but certainly the way in which they are leveraging technology is very different as well. Can you talk a bit about that?
Yeah, absolutely. And I think you kind of hit on it. If you think about the clinical side of it, right? So the clinical side is you want to reduce variation. So you're reducing waste in both in terms of the time that a physician or a clinician is spent interacting with technology, because you have a patient and a child that's sitting in front of you, and you got a family member that you're having a conversation with. And so that's very different than, you go and talk to a researcher, which they want to try the best. They want to try something new. They want to try something for a period of time and then throw it away because it's not working for their advancement and their research interests. And so it's a very different mix. It's almost like you got to put on two hats when you're having those conversations, because one is a very controlled space, and the other is disruptive on purpose and by design.
Very well said. When you and I last spoke, Keith, you talked about the strategy setting process of the company, and that it is itself a great strength. There's both short-term and long-term ways of thinking about things. I was just reviewing, in fact, the 2022 6-year plan, $12.9 billion associated with it. So interesting to just hear about the time horizons that are put against some of the planning process. Can you talk a bit about that process and how it works? And I would love to understand, by extension, how it then leads to the work that you and your team do.
Yeah, it's a fantastic process, and we get together and we're talking about strategy all the time, and most organizations can say that because strategy kind of underpins where you're trying to go. But when we get together, and I think there was a year and a half ago, the leadership team got together, and our conversation wasn't about strategy for the next 5 years. It's strategy for what are we going to look like in 2040? Like, what are we going to look like in 2045? Well past our time of service here. So where do we want St. Jude to be in the future? And there's a common question that kind of underpins everything we do here. And it's if St. Jude doesn't do it, then who's going to? Who's going to step into the gap for the children and the research that's going to ultimately impact that child? And so we're asking and answering those questions, and it leads to growth in clinical trials, translational research, basic science growth, and how we're thinking about the cell and getting down to that level, and then how does that translate into clinical care? And all of that is kind of underpinned by, like I said earlier, that the technology that's needed. So it kind of guides us on where are we storing our data? How are we thinking about high performance compute? Where are we thinking about GPUs? Where do those need to be from a cloud perspective, from a on-prem perspective? How close to the instrument? So it's that, in addition to how do we optimize our administrative function so that we're as efficient as we need to be in order to serve and service the mission. So all of that kind of underpins where we think about technology and how we serve up technology to the mission.
And I know that there are aspects of the plan that also led to some of the patient journey modifications, also led to some of the modernization of technology. And I wonder if you could talk a bit about some of the specifics of how the plan informed that and the actions taken.
Yeah, I'll kind of talk about the modernization first, and because I get really excited on the patient journey, and I will most likely spend a lot of time there. But the modernization, we're sitting in our incident command center during COVID, and our strategic plan started in 22, and in 20 we're thinking about how do we come out of this better than we went into it. So how do we come out of this incident command process and as an institution, different than than the start of the pandemic. And that's led to, look, our implementation of our electronic health record was not going to sustain us. The way that we had implemented it was just many things, and so we made the decision we need to transition to Epic, and we made that transition during the strategic plan. The same thing with Workday, and we had so many administrative applications bolted on to our infrastructure that it was very hard for our knowledge workers to get work done, right? And so we made the decision is we need to rip that out and really optimize the tools, and we put in Workday. And so there's all kinds of things that kind of come out of that strategic planning process around optimization. And we're going through that same exercise now around, okay, how do we make sure that we're optimizing ourselves for the future? So that's around the optimization piece of it. The patient and family journey is an interesting one. And this really started during when I first started here. And you cannot step foot on campus without feeling the empathy for a family member. If you have children, if you think about it for a second, if your child is impacted and gets those words, they have cancer or they have some disease that's catastrophic in nature, you're immediately, what can I do to help? And so that's kind of led us to partner with our patient experience team. Some of the conversations with the CEO, it led us to developing a patient mobile app for our patients. And it's not a mobile app that you would find if you went to another hospital. It's a mobile app that's really tailored to St. Jude family. So we fly our patients to Memphis. We put them up in our housing facilities. We provide school for the children during their care with us. We have our own salon, so we have the ability for them to book salon appointments, and that includes their family members as well. We pick them up at the airport. We take them to grocery shop, and so we've got this Uber-like experience that we've built in. So I kind of liken it more to a concierge app that you would find. And then we include their clinical activity. So we include their calendar events that really guide and shape their time with us. In addition to, hey, where are the therapy dogs today? I want to make sure I get over to them. So let's put that on the calendar. And it's just a kind of a holistic view of their interaction with St. Jude. It's not meant to replace the interaction that they have on campus with us. It's really meant to augment that experience. And so we continue to find ways to kind of grow and build that from a patient family perspective. And it's interesting that wasn't IT sitting in a room thinking of this. That was really a partnership with our patient experience team, but we also have a fantastic family advisory board where we're sitting down with them. And these are families that have either their child is in treatment or they're out of treatment. And they're helping guide us in terms of what would be impactful, what technology would be impactful for them, for other families that are coming behind them.
Truly inspiring. Thank you so much for sharing those details, Keith. Fascinating to hear more about the role that technology can play to aid care and experience. As you mentioned it right at the top, one of the key differentiating aspects of St. Jude's is the research agenda that the organization has. And you and I have talked in the past about the role data science plays in that, in aiding the research. And I wonder if you could talk a little bit about the methods you and in partnership also with a relatively new chief data science officer, how you're working together to develop new methods to aid that research.
Yeah. So, my role from the technology perspective is to make sure that we're bringing that technology to bear. And so partnering with our new data science officer, where he's focusing on, how do we think about data governance? How do we think not data governance from the sharing and the genomic, all the data that we're producing on the scientific side? How are we sharing that? How are we classifying it? And so that's really a partnership model. And for one example, left unchecked, our data is growing at about 30% a year. And it's not like you can go down to Best Buy and buy, several petabytes of data storage. So we have to make sure that we're being good stewards with the money that we've been entrusted to use. And so it's really a partnership model. Is how do we think about the data that needs to be stored? How long do we need to store it? And can we archive that off? So we're having those conversations in addition to where do we need to be advancing? So what GPU clusters do we need to be bringing in, and how should we be partnering with technology vendors and providers to really get that technology, like I mentioned, into the hands of the researchers that really have some questions to answer, and they don't want to wait 6 months to get an answer to something that's really driving their discovery.
Fascinating. Really interesting to hear more about how that's advancing. I wanted to ask you also, are there, as you look to the future, Keith, are there any trends that particularly excite you beyond the ones that we've already noted that you believe might have a positive impact on St. Jude's?
I think the growth in chips and, just the amount of energy and time that is being poured into the new and advancing chips. So whether that be a GPU chip, and we're already starting to see some of the fruits of that with, we can't have a technology conversation without talking about generative AI. I think that's really exciting when you think about what the future is. And that's really the core of that, is how the technology is really advancing in order to meet the needs of what tomorrow kind of looks like for us. And that's one. I think the other, and this is probably going to be something off the wall, is when I think about trends that really excite me, is I'm no longer having conversations where I'm having to champion the need for information security controls. I think that leadership across, whether that be at St. Jude or in other organizations, they are starting to recognize the value of good security controls. And so, in the past, 10 years ago, it would have taken me 6 months to try to get leadership to agree to, hey, we need to increase the number of our password characters from X to Y. Now it's like, okay, yeah, we get it. So it's kind of like we've moved on. So I'm hoping that trend continues, and we still and we're all fighting the information security challenges together.
Again, well articulated, super interesting. I also wanted to ask you, if I may, anything you've recently read, watched, and or listened to, Keith, that you'd recommend to peers?
Yeah, I'm reading the book Team of Teams, and we're reading that as a leadership team because we're having a conversation around culture. So with our strategy, we talk about strategy a lot. We talk about culture a lot as well. And what we're trying to do is we're trying to make sure that we understand what our culture is, that unwritten thing that kind of guides the organization. And so we read books, and we talk about those books, and we talk about how that applies. So I'm currently reading Team of Teams. And then I love podcasts. Peter, I love yours. And this is not a slap against that. But I also love the Acquired podcast. It's a fantastic, it's more of to me, I look at it as more of a history lesson with some business kind of woven in. It's just fantastic.
That one comes up a lot, and I certainly am an enormous fan of that as well, as I am of Team of Teams. Both great suggestions, certainly.
Yeah.
Well, Keith Perry, thank you so much for taking time with me today. It's been inspiring to hear more about the work that you and your team are doing, the advances that are happening at St. Jude on behalf of the patients you serve, and also inspiring to hear more about the manner in which you serve them and the role that technology plays in doing so well. Really appreciate your time. Thank you for it.
Thanks, Peter.